Welcome to the FemiNinja Project. I am your host, Cheryl Ilove, middle-aged ninja hiding in plain sight, dedicated to restoring human dignity one person at a time and helping you unleash your personal power. Discover that it's possible to look like a woman, act like a lady, move like a ninja, and think like a warrior. And remember, men are always welcome on the FemiNinja Project. I have a very special guest with me today. She is a colleague, she is a friend, and I do believe she's my soul sister. So I just want to welcome Margaret Woodward to the show. Margaret, welcome to the FemiNinja.
Thank you for having me.
Thank you so much for being here.
Yeah, thank you.
And Margaret, you are one of my favorite people. That is without a doubt the truth. And we've known each other, we were trying to figure it out, about 15 years now.
Yeah, it's been wonderful.
Oh, why, thank you. And I have to tell you that, honestly, and I'm not exaggerating, I do exaggerate every now and again, but I'm perfectly honest when I'm telling you that you helped save my life.
Oh, thank you. You were in a difficult time.
I was, and a lot of people don't know it, and it's even hard to talk about sometimes, but it was a really tough situation where, and I have mentioned on the show before, people do know this, so it's not like I'm divulging a big secret, that I was assaulted at the age of 44, and it was actually a physician that did it. And, I went from being a healthy, vibrant, 44-year-old woman to being a statistic. And the way that I was treated afterward, I just had, even by the people, who were closest to me. So I just kind of had to bottle everything up. And of course, when the dam broke finally about a year or so later, and that's pretty much when the journey into martial arts almost started. Right. But I was left with a lot of incredible pain syndromes too. And one that was so painful, so horrible, was called interstitial cystitis. That is the term that I was diagnosed with.
Right.
So you are, of course, a physical therapist, but you specialize in a lot of different areas. And one of the things that you do specialize in is pelvic floor dysfunction. So I did have a PT on a couple of weeks ago who's talking about the pelvic floor and how it works and some of the problems, but she never really talked about interstitial cystitis, pelvic dysfunction in regards to any other type of function.
Right.
And
right.
Disease state or discomfort that if you want to address that, I'd really appreciate it.
Sure. I got into pelvic floor therapy about 18 years ago. Mm-hmm. So I was one of the pioneers in Denver to start doing the pelvic floor. My associate at the time and I were one of the first in Denver. There were a few others, maybe two others, mm-hmm. Who were doing it at the time. Mm-hmm. It was a wonderful experience. It was a wonderful learning curve. It definitely filled a passion in myself to reach people in a way that the community, the medical community, the culture wasn't reaching mm-hmm. and leaving a void. Mm-hmm. Pelvic floor syndromes are very, very common. Mm-hmm. And they are something that people don't talk about. Mm-hmm. Culturally, we don't discuss the anatomy, we don't discuss the problems, we don't discuss the pain, we don't discuss the dysfunction because culturally it's frowned upon. Thank goodness for Betty Ford for her breast cancer back in the 70s, because then we were actually able to say the word breast. Mm-hmm. So following breast cancer complications, we were able to actually have conversations regarding breast cancer, conversations regarding treatment for complications. Mm-hmm. The issue, though, didn't transfer over to the pelvic floor.
Right. Well, it's funny that you mentioned that because I remember even as a teenager that people would whisper, well, her grandmother has...
Yeah, because
we didn't... What is that?
We couldn't say it until Betty Ford began to say it in the news.
Jeez. It was shocking.
It was shocking. But we still don't talk about female anatomy, gynecology. At the time that I was starting to practice pelvic floor, the majority of the patients that I was seeing, probably 70%, had been told that it was in their head.
Of course.
70%. That was huge. The amount of help that we were able to do was phenomenal. First, we had to educate the people towards what the pelvic floor was. The pelvic floor is simply a sling of muscles at the base of the pelvis. They support the organs being the bladder, the rectum, and the uterus. They have a sphincteric function. They help to stop urinary accidents. And they have a sexual function. So they do have 3 important functions in our lives. Sometimes what happens, there are a lot of different reasons why, there are hundreds of reasons it seems, that the muscles at the base of the pelvis become overly tight. If you think about having a calf spasm, it's the same thing. It's the same kind of muscle. It has the same properties. It just has different function. The calf muscle spasms, you have a hard time walking on tiptoe. Most of us have had Charlie horses in our spasms, in our muscles.
But there's no shame in the calf muscle spasming, and you can, everybody's pretty much experienced it, and it's like, oh, you point to your leg, so it's not a taboo place to talk about. It's not frowned upon.
Right, but you go into the doctor, and they say, just relax. Say you walk into the gynecologist office for your annual exam, and they insert the speculum, and the woman's crying because she doesn't know it, but her muscles are so tight that she can't even get a speculum in. A lot of gynecologists at that time would say, well, just relax and blame it on the woman.
Of course.
Or they would say, just take a minute, just let me finish, without honoring the woman. Suck it up. Exactly. So once the muscles become overly tight, we can have a bunch of things happen. We can have pain with intercourse. We can have pain referrals. People don't often, we don't know this, low back pain that does not resolve. The MRIs are negative, the x-rays are negative, but people say, I have low back pain. They go back to the doctor, and the doctor says, well, it's all in your head. Those are the people who I say, come to me, because chances are it's a pelvic floor that's too tight and it's referring its pain to the low back.
That is the main reason why I found you and your colleague.
Yeah.
That was a physical therapist that was a client of mine. And she had chronic low back pain, for years and years and years. And, being a physical therapist, and she had so many incredible skills. This woman was very well respected in the PT community. And it was just something that plagued her for years, where she would actually have to take time off work and just lay flat on her back. And she was seeing another really gifted manual therapist in town. And finally he said, you need to check out this pelvic floor therapy. I think that would make a difference. And of course, as you and I both talked about earlier, we're so skeptical.
Right. Well, being Western minded, that's what happens.
Exactly. You get stuck in these thought patterns and these belief systems. And so this client of mine was the same way. She's like, I don't know how this is going to work, and what's this going to do? But bless her heart, pain is a very motivating a stimulant or a factor. Yeah. So she tried, she was like, she couldn't believe the difference. She could not believe when they finally, when you worked with her pelvic floor, all of a sudden her back pain resolved.
Yeah. It's very, very powerful. There are a lot of people walking out there who don't understand why they still have back pain, because everyone says nothing is wrong with their back. That's because nothing is wrong with their back. I always think about, it makes me chuckle, I always think about the Raiders of the Lost Ark, when he finally drops down into the room and he inserts the staff and he puts the round gold circle on with a hole, and it drives that line down, and he stares at that and he says, they're looking in the wrong place.
Yeah.
And that's what I always think of. They're looking in the wrong place.
Exactly. I think they said that you're digging in the wrong place. Was that it?
No, that could be it too. Yeah, exactly. But it's the same idea. So back pain can be referred from the pelvic floor, and people are being told nothing is wrong with their back, and they're being dismissed. Lower abdominal pain. It feels like menstrual cramps. That can be pelvic floor referred pain. Groin pain can be referred pain from the pelvic floor.
Even knee pain and knee dysfunction, because if you don't have a functional pelvic floor, then that could be turning off your inner thigh muscles and putting your knee in a bad position. So it's amazing how my own personal experience with Western medicine, both being a practitioner of it in two different fields, art, respiratory therapy, and PT, is that we had a tendency to look just at the organ of choice or the joint of choice and not at the entire picture.
Insurance mandated that back in the 1990s, the late 1990s with the HMOs, that was mandated. They have since changed that, but we still are limited under insurance regulations to some degree, unless we can document logical reasoning for treating a different part. Regarding the knee, one of the things that I think is that I see the most is when I have somebody who walks in, they have low back pain. Nothing is quote unquote wrong with their low back pain, with the low back. So they have pelvic floor issues. When I go and I do an evaluation, and the evaluation is extremely detailed, as you know.
Yes, I remember.
And I look at the hip, and the hip doesn't function. Or it's functioning. The joint itself is fine. The muscles aren't controlling the hip, how it's functioning very well. So one of the reasons why it's not functioning is because of the pelvic floor. We fix the pelvic floor. We fix the hip muscles, because those two always are going to go together. That is what takes the knee pain away.
It's really funny that you should mention that, because after working with your colleague, because she started me with the pelvic floor therapy, and after, the results were just phenomenal. And I'll never forget the first time, because I did the evaluation with her, and when she was finished, she looked at me and she said those magic words, "I think we can help you." And I didn't cry, because I don't cry in public. I'm the ice maiden. So, but when I went home and I said those words to my husband, I just lost it, because I had been suffering for over 2 years with this, and it just kept getting worse and worse and worse. So it's almost like, I don't want to say peeling an onion, but it is the layers of, the problem that, you're peeling back with the different spasms and stuff. And as Stacy explained to me, my pelvic floor was flat and hard like a plate, and it should be like a bowl and have that buoyancy to it, that natural buoyancy. So as she was helping me and my symptoms were decreasing, finally she looked at me, she says, "I think you need to see Margaret. You have a hip problem." And I said, "I don't have a hip problem." She said, "I think you have a hip problem." So I'm rolling my eyes, and it's like, okay.
You did. Most people will with pelvic floor. It goes hand in hand.
It's just crazy. So you worked with me with the hip, and what was so wonderful and so beautiful about everything about you is wonderful and beautiful. You're just an amazing person and just the greatest practitioner on the face of the earth, I believe. And you weren't telling me what was wrong with me. We were doing this together. So it was almost like we had our little detective hats on. And so you were explaining to me, and I'm thinking about it and stuff. And after you had given me some exercises, you taped up my hip, sent me on my way. We made the next appointment. And so I'm at home and I'm trying to figure things out, and I went, I had this aha moment. And I came back to you for my next appointment, and I said, "I think I figured it out." And you said, "What?" And I said, "I think I'm using my hip flexors."
Oh, I remember that. To
turn out in ballet class. And you just kind of went, "That's not possible." And I said, "Yes, it is."
Yes,
and you said, "No, it's not." And I said, "Let me show you." So I showed you, and you said, "I can't believe you're doing that."
Well, that's a true ballet dancer. Somebody who's so skilled at doing what should be the impossible. But you did.
And compensating and making everything so much worse.
What was amazing is because you were so self-aware and so body aware, you were able to fix your own hip. I remember that. I was trying to tape you, and I said, "Well, move this way." "Oh, like this?" And I went, "Yeah, that's exactly what I wanted you to do. How did you do that?"
Years and years and years
that was
of
terrific.
Self-exploration.
And gosh, I remember that.
And that's why I'm so passionate about the show that I'm doing, the FemiNinja show, and talking to people like you, because education is so powerful, and if you understand your body more, then you're not at the mercy of somebody else telling you, hey, you're just crazy, it's all in your head, let me give you these medications. Because before I finally broke down and went to see, Stacy for the pelvic floor work, I mean, I was at the urologist. They had me on many medications that were really horrible side effects. I mean, I was the like double vision and the dizziness and nausea. I was getting nauseated and I couldn't eat. I was down to under 118 pounds. It was not a pretty sight.
That's not good.
And so the last time I went to that I went to the urologist, and he says, well, we'll give you more medication. And he gave me some samples to try, and I flipped it over, and I looked. The first side effect was nausea. And I'm like, no, I'm already nauseated. No. Look at me. I can't eat. And he said, we'll just give you something for the nausea.
No.
I know. It's like, okay, so, and that's when I say that you and Stacy truly did save my life. And, I haven't seen you in a while, but I would, go probably once a year or so for a tune-up, or if I feel something was a little bit off, it's like, I need Margaret.
Yeah. Well, it's interesting. There's so many points that you've brought up. One of the things is how much pelvic floor dysfunction affects our relationships with our spouses and our significant others. As I mentioned before, painful intercourse can be a sign of a pelvic floor dysfunction, and that's treatable.
Yeah.
But people just don't talk about that. So, but that affects our lives. It affects our self-confidence. It affects our quality of our life and our relationships, and that can be very, very frightening. That can roll into a stress and a self-blaming issue.
Absolutely.
And the self-blaming and the stress increases pelvic floor dysfunction.
Any kind of stress.
Spasm.
Yeah, it puts you in fight or flight.
And
so
that's
in
pelvic floor.
There you go. Sympathetic nervous system.
Absolutely.
It's survival, so it compounds the problem.
Absolutely. So then we have the stress component. And then we have the fact that the doctors don't listen. And I have to say, and that's not necessarily a fault of their own. I was talking with a specific urologist, I don't know, years ago. I was still at my old clinic. This is probably 15 years ago. And she was just getting into, she's a physician. She wanted to get into pelvic pain. So she began studying. And she came out of CU 92, 93, the CU med school. So, which is a highly ranked school, top 20, top 25, something like that. And she was coming out of that. She came out of the program. She's getting into pelvic floor now because she recognizes as well that there's not enough understanding of this area. And she's a female urologist. Great. So she goes back and she pulls out her anatomy book from the CU med school because she wants to learn the nerves of all the body. So she finds a schematic in her med school book, and it has all the nerves. The pelvis is blank. CU med school at the time, I'm sure they've changed.
I'm sure.
At the time, wasn't even teaching in the 90s. And that's only 20 years ago, if I'm doing the math right.
Yeah.
20? That's way too long. 20, 30 years ago. So they weren't even
addressing it.
No. So physician-wise, they weren't being taught. Additionally, we have to remember the physicians are taught to look for disease.
Exactly.
They are the disease specialist, the physiology specialist, and hopefully the biochemistry specialist. They are not the musculoskeletal specialists. Now, I remember hearing that when I was in school at the CU Physical Therapy School in the early 90s, I was talking to a med school student, and they said, they had like 2 days of the musculoskeletal system during the whole training. To be fair, we go into our anatomy lab, and we have our cadavers, and we open things up, and we say, oh yes, those are the organs, and we take them out. And then we study the muscles.
Well, so I went to CU not long after you did. Because I graduated in 96.
I'm 94. Yeah.
There you go. Oh my gosh, we just missed each other.
Yeah,
then.
we did.
That's so funny because when we were doing, the cadavers, and this is so funny. Of course, like you said, there's the organs there. That's interesting. Take them out and you're
Right.
looking at the muscles and the
Right.
bones and the nerves and the blood vessels and stuff.
Right.
But when we got to the chest, I was just in heaven. I mean, everybody's like, move on, because I was
because you're
finally,
respiratory.
getting into really looking at the lungs and the heart
Yeah.
and the valves. And to me, it was, the pulmonary arteries, all that stuff was just
Yeah.
fascinating. And they're just like, come on, move along.
Yeah.
Nothing
So
to
it's
see here.
Well, it's amazing. So we don't have the physiological
Right.
background expertise that they do.
But they don't have our musculoskeletal
No,
expertise.
they do not. So I can't speak for them, but my experience and my wording for how I see their approach is that they see the pelvis as plumbing. And most of the time they see everything happening as simply plumbing or baby birth or something. They don't see the whole pelvic bowl and the muscular component of that. One thing I didn't mention before is that one of the other symptoms besides pain is urinary frequency. It feels like you're having a urinary tract infection.
Yes, I remember.
So you go to the doctor, and I have to say, we always encourage our patients to always request a culture. Hopefully they're cultured. And if the urine culture is negative, they should not be given antibiotics because chances are it's a pelvic floor spasm. The pelvic floor spasm is going to mimic a urinary tract infection. But the doctors are getting better at that. But for a long time, they were just saying, well, I don't know what it is. It must be a urinary tract infection. I just can't find it. Here are your antibiotics.
Or it
Over
must be
and over and over
stress,
again.
because that's what I got. Because they did not give me antibiotics.
Is
Because
that
which
amazing?
is good because I didn't have an infection, but they would say, well, obviously something's not right, something's wrong.
They were right.
Yeah, give them credit for that.
Yes.
But I had never even heard of that term interstitial cystitis before.
Yes.
So to me, it was almost like a new disease to fit some symptoms. Does that make sense?
Yeah, to me, I could be wrong. Medically, they may disagree with this, but in terms of my background, my musculoskeletal background, I see the term interstitial cystitis as being more of a garbage pail term.
Yes.
There is no real way to identify it. We used to think that during a scope, which they call a cystoscopy, going up to look inside the bladder, that they would see what they would call lesions, little sores on the lining of the bladder. So they would say, well, that is, they have positive IC, interstitial cystitis. Well, then they found out, I don't know, early 20s, late 90s, that using the scope was not necessarily definitive. The lesions was not definitive necessarily of IC. But there were people who had IC who didn't have the lesions. They don't know why necessarily, but they're looking at, there are dietary issues.
Right.
There are infectious issues. There's autoimmune issues. For a while I was hearing that there was thought that the IC was part, a chronic IC, was part of a syndrome, because IC would come with symptoms of bipolar, irritable bowel syndrome, depression.
Well, let me tell you something. If you're not depressed when you have symptoms like that, there's something wrong with you. And that was another thing that was at my last visit with the urologist. He says, there was one more thing I want to give you, and that was, Prozac. And I'm like, I am absolutely not going to take that stuff. And he says, no, you don't understand. It's a pediatric dose. And I'm looking at him going, you don't understand. This is a pediatric body right now.
Yeah.
Look at me.
Exactly.
Look at me. And he goes, well, you look it up online and you give me a call and you'll say, you were right all along.
It's not Prozac.
Yeah. So I did go home and look it up. And that's when I said, okay, that's when I called Stacy, was I was looking up interstitial cystitis. And when I got to the IC store, and there was a book.
Oh, yes.
Remember I told you that?
Yes.
How to live with the IC patient. And it was a guide for spouses and family members to deal with the crazy person they were living with. Basically, in a nutshell. So I just turned and I looked at the look on Mike's face. I looked at my husband and I said, rest assured, I will not live like this. I will not live with this. I will kill myself.
And that's when you call someone like me, because we don't need that happening. They do use amitriptyline, which is an antidepressant. They'll also use tricyclic antidepressants. The amitriptyline there is a thought that histamine, it's a mast cell problem in the bladder, and that the mast cell is producing or releasing too much histamine that's irritating the bladder lining. And so amitriptyline somehow does have a role in decreasing histamine. So there are medications. Prozac is not one of them. That's treating depression, not IC.
What you can do, though, is just call Margaret and go see her. So, and you were talking earlier about insurance and coverage and all that stuff. And you work you work at a clinic in Littleton, but you have started a transition, a life transition. I mean, I'm so excited to hear what you're doing right now. And
Thank you.
It came not easily. It did come with some painful journey and life's lessons, like everything does. So if you want to just share a little bit about that, that would be wonderful.
I've had a great career at my clinic, and I was working very hard, and I became very tired. I was fighting a lot of fatigue. At the same time, I was stressful about becoming an empty nester. My second daughter was going to be going up to CU Boulder soon. And that meant that I was going to be an empty nester. My older daughter had some health issues, and that had been a level of stress. So I had a lot of things that I was working through between being a mother of trying to help her daughter get her health better, losing my second daughter to CU Boulder, becoming an empty nester, and what do you do with that, and working a full-time job. So I had begun to do some self-care in advance of this. I was working with a counselor to help me work through the transition and be empowered before I went through all of this.
Because that's stressful on your marriage, too.
It's very stressful on the marriage. And
the dynamics are going to change.
Yes, and my parents had divorced at that point.
Oh.
And I really didn't want to repeat that. And we all know that patterns can be repeated. So I was going to fight through that and be defiant. And anyway, so I had become more and more tired. I'd gone to the doctor in May, and he said everything looked pretty good. My A1C was going up a little bit, which is a type 2 diabetes
indicator.
Yeah. And he said, let's keep an eye on that. And I said, that sounds great, because I was still right within the margins. So by about August, I was getting really, really tired. I was in bed a lot. By October, I was losing my hair, and I had recurrent bladder infections. I had yeast infections. I had thrush in my mouth. I had basically everything was falling apart. I would work my full-time job, come home, and go to bed. I don't know. Well, that was the funny thing, because eventually I actually couldn't drive. My younger daughter had received her permit. We had both the daughters wait an extra year. She had received her permit, and she was practicing, and she would drive down to see her boyfriend, and I would maybe drive her down, but she had her permit. So actually I would be in the car, but I would drive her down, then driving back. Cognitively, I just couldn't process where the lines were. And I thought, this is really bad.
Yeah, that's not a good thing.
No. And then by November, my house was a mess. I couldn't vacuum. I couldn't do the dishes. I couldn't cook. I couldn't shop. My husband was doing all of that, and he was in a very busy job as well. And I thought, well, my life is over, and I'm probably dying.
And how old were you?
I was 50. Oh. I was almost, I was 50. I was actually 49.
Okay.
I was 49. I turned 50 December 29th. So almost the last straw was walking up the stairs. I made it 7 stairs, and I couldn't make it anymore. And I guess she was 17, she put her hand in my back and said, "Here, I'll help you up the stairs." And I almost started crying, because that is not what I think should happen. I don't think a daughter should have to help her mother up the stairs in any normal circumstance, which means that this is not normal. Yeah. Something is really, really wrong. My vision began to go in November. I wasn't able to see as well. Everything was very blurry, and I would walk into a room, but I would misjudge where the door frame was. So I was walking into a lot of corners. I was tripping, I was falling. So when my vision began to change, people say, why did you wait for the vision to change? So I don't know. That was the last thing. I figured I was stressed. I was fatigued. I probably had adrenal failure. People talk about adrenal failure. Maybe that's what I have. So I just kind of said, well, or I'm dying. So I went back to, I talked to my husband first, and I said, I think my vision is changing, and I think it changed this week. And he said, nah, it's just been changing the whole time. You're just now noticing it. And I said, I don't think so. So I went to my eye doctor, and he said, how long has it been that your eyes have been changing, do you feel? And I said, well, if I'm going to be fair and exaggerate a little bit, because maybe I'm making a bigger deal out of this, so I better try to give myself a leeway, 5 days. Otherwise, if I'm being honest, probably 3. And he looked, and everything had changed. My vision was entirely different, and I had seen him 6 months prior.
Wow.
And he said, you have to go see a primary care physician. So on December 12th, 4.5 years ago, I was diagnosed with type 1 insulin-dependent autoimmune diabetes. I started insulin, and I became very defiant. I was, in a good way, I had the best diet. I had sardines for dessert. I was so compliant. I lost 20 to 25 pounds. I was very good, but only recently, and I worked the whole time, and only recently, about 9 months ago, I realized I just can't continue the pace that I'm going. I continue to push. I was spending 4 or 5 hours in bed on Saturdays and Sundays between 1 and 5 or 1 and 6. And my husband, bless his heart, was very kind and accepting. And he was busy. He was stressed. He wasn't up to going traveling or something. He was doing his jobs. He was working over the weekend. So anyway, so I made a decision. I talked to my husband, and he and I agreed I could cut 5 hours at my clinic, 5 patient hours at my clinic. But I have another daughter to get through CU Boulder, so I don't feel right about lessening my financial contribution. So I decided to open my own clinic.
I'm so excited.
Thank you very much, and I am very, very excited. It's been building slowly but surely, and I'm specializing in pelvic floor as well as the craniosacral therapy and also traditional PT. My specialty though is neck. It's all kind of in a line: the neck, head, neck, shoulders, hips, pelvic floor.
Head, shoulders, knees, and toes.
Yes, exactly.
So tell us a little bit more about the cranial sacral therapy, because a lot of people might not know what that is or how it works. And as we were talking before we started recording, it is magic.
Oh, it's amazing. In this culture, I think that it's so needed. That's also one of the things that I began doing for myself before the transition and before I became sick, was receiving cranial sacral therapy for stress relief, because I had enough stress in my life at the time. Cranial sacral therapy is a very light touch therapy, and it focuses on the nervous system. People think you only work on the head. You work on the whole body. It's nervous system, and it's also working directly on what's called the fascia. The fascia being all the connective tissue that weaves in and out of all the organs and all the muscles and all the tendons and everything that you can think of, arteries. And it weaves and covers everything and protects everything. But if there's stress, if there is a response, and some people and some research is indicating that the mind-body connection is located in the fascia.
I've heard that.
Which I think is
that's fascinating. Because we used to be told, and we were taught when I was in PT school, that the fascia was just kind of like, the dead zone. It's gristle. It's not even really, live tissue. It's just there to separate the muscles and the muscle fibers, and that's not true.
It's not true. But when I went into physical therapy school in 1992, the transversus abdominis, the primary core muscle of the trunk, did nothing. And when I came out, it was the universe. The center of the universe was transversus. So everything kind of flips. So I explain to people that the fascia is if you skin your chicken, it's the white slimy stuff that's remaining. That's fascia. So it envelops everything. It envelops the nervous system. So I used cranial-sacral therapy as an adjunct to physical therapy, which I think is a terrific combination. Working with the nervous system, first of all, it brings the person out of fight or flight, stress, feeling overwhelmed, having to do too much, not doing self-care for a long time, feeling like they've been ignoring themselves for too long, and just bringing that back down to a place of peace and openness and deep relaxation. And as they are able to reach that relaxation, the amazing thing is the brain is able to relax and think of options and choices and think of different solutions to problems. And all of a sudden, life doesn't seem so hard, and we don't have to push through it. We can just let things kind of happen. I also use it for pelvic floor therapy.
I think it would be so powerful for
the
that.
pelvic floor muscles and the structure of the pelvic floor is considered a diaphragm. Diaphragms are fascia. There's tons of fascial connections between the hip, the pelvic floor, the low back. So releasing the pelvic fascia is huge. People will say, oh, I just feel so much more open. I can breathe. I could get breath all the way down into my pelvis now. And I didn't know that I could. It reduces the tension of the pelvis. And working on the nervous system reduces the stress that's contributing partially to the pelvic floor dysfunction. So
because we're so integrated. Everything is connected.
Everything is connected.
You cannot separate the parts of the body or what's going on in your life and how it's impacting you. And the fascia especially, it's just so fascinating because of the role. I mean, that's even responsible for like chemical changes, the neurotransmitters.
Oh, huge. Yes.
And even, lymph flow, I think they're finding now in the fascial tissue and stuff. So
That's right.
It's so funny that we were taught that there was nothing there. However, then, because I took some cranial sacral classes, I told you that.
Yeah.
I was thinking about going into that, and that was after I became a physical therapist. So it's like, well, if that's all dead space or, non-viable tissue, then how is this gentle touch impacting the entire body? And it's really interesting because just the first time I could really feel the pulses, because of course back in my respiratory therapy head, we used to take pulses all the time and stuff. It's like, I can't put my hands gently over somebody's head and I'm going to feel some pulses there. And it was just like,
but they're there.
Because there's movement in our bodies. It is constantly moving. Even when we're sleeping, our bodies are moving. Yeah. And it's just like, the stuff of life.
It is, and as you intimated before, you and I have always been Western thinkers. You and I are the great cynics. And what have...
I wear that proudly.
Well, and both you and I tend to push through life. And I think culturally a lot of women and a lot of people that we do that. We're told to do that. You and I would not have been open to this kind of treatment. And yet it makes so much sense after experiencing it. It just makes sense. And people, even this morning, I was working with a mom who feels a lot of stress and tension, and she has pains every now and again. And I was talking to her, and at the end, she just said, "I think I've just figured out a whole lot of stuff in my life that has to change."
Oh, wow!
It's a real catalyst, to use your term. It's a real catalyst. I use it in physical therapy for structural changes that I want to. I can get into the hip flexors to release that.
Right.
I can get into the pelvic floor to release that through cranial sacral. Or I can help somebody get to the other side. And as what I went through, becoming a type 1 juvenile diabetic and trying, and at 50 years old.
Yeah. Wow.
And then trying to change my life in a way. And then when I began changing my life, I was realizing how much I was holding on to control, direction, push through, defiance. I will, I can, I have to. I'm being told that I have to. And I'm getting to the point that no, I don't. It's actually going to work better if I just breathe. And if I just recenter and let go of the preconceptions, and that's been able to happen, and the audio tapes.
Right.
That's been able to happen to me because of the cranial sacral work that I've been receiving on for myself. And I really want to be able, I feel like my passion, it's always been helping people, pelvic floor, pelvic pain, trying to reach people who have not been able to receive help.
Right.
And now,
or have been told there is no hope. There is no hope.
Oh, I've heard that so many times.
Me too.
All my patients have told me that so many times. I had a thing of pelvic floor. I had a 26-year-old who came in who had such bad pain. They finally gave her a full hysterectomy, and her pain never changed. It was musculoskeletal.
Oh my God!
I had another gal who was a nurse, and she was going to have a full hysterectomy, and she said, "I don't want a full hysterectomy. I think I could do something else." So we worked on the pelvic floor, and she was so body aware. We got rid of all the pain, and she was able to localize where it was.
Wow.
So they just took out that one part of the organ. I forget which one it was. But the one gynecological organ they removed without having to do a full hysterectomy, because the pain, we centered it down to one area. It wasn't just this whole thing.
Right, because it does kind of spiral and gets out of control. Because once you have pain, and then you've got the spasm that goes with it, and then you've got the stress, and then you've got the heightened,
and then you've got the fascial system involved, and you're in fight or flight, and your relationship is being involved. All of a sudden, now we're in craniosacral.
Yeah. Wow.
So again, it's all hand in hand, and being a woman who's going through a transition, who's been ill, I just want to live in the peace, and I want to give that peace to others the way that it's been given to me.
Well, I tell you, you are really good at it. You probably don't realize that that's what you have been doing all along. But I think that happens to people like us who are in helping, type of professions.
Sure. We're very patient-centered.
Patient-centered.
So being very patient-centered, we're not going to be thinking about ourselves. We're trying to think of what we can do for them.
Yeah.
And then over the years, we realized that we've been doing this for so long, and it's a passion, but we also have to somehow bring ourselves into the picture as well, and there has to be a balance.
I can remember even when I was still a respiratory therapist, and that's when my life was falling apart for the first time, in my mid-30s, when I had that horrible, that just incredible back pain, and I was a chronic pain patient for 2.5 years, but I would still have to try and work. And, it was pretty physical,
Yes,
when
it is, and bending over the beds in the hospitals.
Helping to lift patients, pushing the ventilators, that type of thing. And I remember several times going, would you just move over so I can get in bed?
I have felt that way. I think sometimes I feel I've had a stressful day for one reason or another, and I'm doing cranial sacral work, and I have to be centered. And I think, well, gosh, I kind of want to be where you are.
Well, there were a few times when I was at the clinic, because I worked at that same clinic for a while and doing Feldenkrais physical therapy type of things. And I had you on...
Fabulous work.
It's wonderful
Fabulous work.
And I've had you on my table several times, and it was like, well, this is easy. All you have to do is get on the table, and it's like, I didn't even touch yet, and it's like, there she goes, okay.
It's wonderful. Well, where I'm working now, there is a Feldenkrais practitioner.
Is it Joan?
It's Joan.
Okay. Joan is a friend of mine.
Pecos. Jordan. Yes.
Oh, I gotta have her on the show. Because
Yes.
Joan is a Feldenkrais practitioner because of me.
Oh, that's terrific.
It's so funny because she told me when she started the training, and I, as a practitioner, went and did a guest thing there, and she saw me and she came up to me and she says, oh, I just wanted to let you know that you're the main reason why I signed up for the training. And I just looked at her and I said, are you still talking to me?
Of course.
So
she seems like a lovely person. I've been referring people
really
to her.
Lady.
To help retrain the hip, because Feldenkrais works to help the hip move normally, which releases the pelvic floor, so that my work is less, and the patient's outcome is better.
Right.
So having orthopedic PT with ancillary or adjunct therapies of Feldenkrais, of cranial sacral, I kind of call it, I liken it to a mason jar with the rocks, and you put the rocks in there, and you go through physical therapy, and physical therapy is the rocks. When you add the Feldenkrais and you add the cranial sacral therapy, that is the sand. It completes the jar. It completes the healing. Doing only physical therapy, I mean, that's great if we're talking about knee injuries and sprains. Well, I specialize in head, neck, spine, concussions. I mean, normal PT doesn't necessarily address that. So I use all the work. Acupuncture is a great adjunct. All the tools that I have available to me to support the work so that the patient has a better outcome. We want to get them in and out and back to their life
and
in
get
a
them
healthy
back to
way.
the level of function that they want to be at and they deserve to be at. And even with traditional PT, you get to a certain point and then, okay, the insurance, there's no more, they cut you off and blah, blah, blah. And the patient might feel, well, I am better. And then they go home and they start doing the same patterns and habits that got them into trouble in the first place. So there you are back at the PT clinic and, starting over from square one. And I think with Feldenkrais and a lot of those other adjunct therapies, that interrupts those patterns and habits.
You have to.
You can find other ways of moving and going on through your life, just like you did after being diagnosed with the type 1 diabetes. So
there are ways to do it. It'd be fine if we sprained our back and we lived in Shangri-La and there was no stress. The problem is we have back pain, or we have a concussion, or we have neck pain, or we have a fusion surgery, we have pelvic pain. We're thrown back into life. And now we have stress on top of that. That is counteractive to healing.
And it's not a natural life.
No, you're just getting
way
by.
too much. We're on our computers way too much.
We're not in Shangri-La.
No, we're definitely not.
No, we're working hard because that's what we do here in America. We just do.
Well, see, I feel like I'm in Shangri-La right now, just in here in my girl cave, with my weapons and with you, one of my favorite people. This is so wonderful.
You're one of mine. You've always been an inspiration to me. You always reinvent and you always reach out and you just allow yourself to progress and to develop into new, wonderful ways. And I would never have guessed that you would be here 15 years ago. And I'm so proud of you.
Thank you so much. There certainly was a lot of blood, sweat, and tears that along the way to get me to this point.
There are. And like I said, that means that you're human, which is a relief to me and to everybody else. That there are bumps along the road, but that we can still do it, but by helping each other.
Exactly. That's really funny. A funny story. When I was a little girl, I almost fell out of a roller coaster. I was a really tiny little. Oh, this is in the book, and so it's in my book. Maybe I won't tell. It turned out okay,
apparently, because you're here.
But there I was. I was really tiny. My mom had 3 girls in 4 years. So I had my 2 older sisters, and they were very, healthy, vibrant, robust, Eastern European, And I was puny. I was a tiny little thing, and my grandmother actually accused my mom of not feeding me, of not having enough food to feed me. I was just tiny. That's who I was. So we were at this church picnic at the White Swan Park, and it was before they even had the stand up next to this elf to see if you're tall enough. So they put me on the roller coaster, but thank God they put me in a car with my oldest sister. So they figured since I was tiny, they put me with Laura, my oldest sister.
Yes.
And at the end of the roller coaster, there was a series of 3 small bumps, but each bump was a little bit bigger, bigger, bigger. So we hit the first bump, and I flew up in the air and over the side of the little car that we were in.
Oh, you didn't.
Oh, yeah. And my fingers were kind of like dangling, and I could see the adults underneath me. My mother was 7 months pregnant, and she's screaming, and she's running along like she's going to catch me. And so,
what else would she do?
It's
a mother.
I never saw her catch anything in her life.
That's all that we do as mothers, is just run around our kids trying to help them.
Even when they're adults,
right? Yes. There's the stress.
There you go. That explains a lot. So my sister grabbed me and pulled me back in the car, or at least tried to, but we hit the second bump, so I flew even higher.
Oh, no.
So by the time, and by this time, we're all screaming. And she grabbed me, and she was holding on to the only thing she could get, which was the elastic of my underwear. So thank God the underwear held out. The young man...
That was well made.
There you go. They must have been new. And the young man who was running the ride at that point saw it, so he slowed it down. So, we came through the last bump. But anyhow, I tell that story a lot, and it's in the book. And I call it like the bumps in the road.
Yes.
And it's always nice to have somebody there to catch you just in case you fall. Thank God my mother didn't have to. Or someone who just grabs and holds onto you by the seat of your pants.
Well, we have... I love that image. I really do.
That's a great analogy.
And sometimes it's grabbing them by the seat of the pants and pulling them back in their seat and saying, sit down.
Sit down and figure it out.
This is not the time. No, that's a wonderful story because you are inspirational to a lot of people.
Thank you.
Going over the bumps of life. We can't get around them, but there are certainly ways that we can help ourselves and help each other and be there for each other.
So how can people find you?
Well, they can. I have a website that's up now. The address to that is www.hopeptlakewood.com.
Okay, and we will post that on the podcast. So
that would be great. And I'm located, you can also look up, I am located within Pilates Plus Lakewood. And again, I chose to do that because chose to be there because I always align myself with the ancillary or the adjunct therapies so that because I believe that's a complete picture. We are whole people. We treat the whole person.
Well, I love the way you say that you align yourself with that. And I'm giggling here because she aligns herself with Pilates. And PTs are aligning.
I do. So Pilates Plus Lakewood. You can locate me there.
And they do have a Feldenkrais practitioner there. And I have to tell you, Joan and I, actually, we became friends, obviously. Even I was just so happy that she was still speaking to me after I got her into Feldenkrais. But we actually did like 1 or 2 workshops there at Pilates Plus when I think she was still a student. Or maybe it was right around when she graduated. But we did some classes, Feldenkrais Your Pilates.
Oh, I love that.
It was wonderful.
Ooh, I love that. I'll have
together.
to ask her about that because one of my associates there, who's also a PT, she and I are developing a seminar, a series, a talk series on pelvic floor. So that's going to be posted probably on my website when we start, when we get that more developed, as well as on the Pilates Plus website. It'll be a series of 6 or 7 different classes.
Well, if you ever want somebody to come and talk about the pelvic floor and the role of that in martial arts and self-defense and how to keep yourself safe, how to stand, walk, and move like a ninja.
Oh, absolutely. So, I'll bring you on.
You know where to find me.
I know where to find you. Absolutely. Thank you.
Well, Margaret, this has been so wonderful. Thank you so much for coming on.
Thank you for the opportunity, Cheryl. Just to reach out to other people, to see you again, to be with someone who wants to make a difference.
Yeah, well, together I like to think we can change the world.
I think we will.
And I think each and every one of you out there can as well. So I really appreciate your listening to the FemiNinja Show. I would love your comments, your questions. Contact Margaret. Check her out. She is as lovely in person as she is on the podcast. So until next time, you might want to figure out your pelvic floor. It really does make a big difference to your health and wellness. Okay, thanks a lot, everyone, for listening. Until next time, bye now. And that's a wrap on another episode of the FemiNinja Project. Thank you so much for listening. And remember, be safe, be strong, and until next time, bye now.